Hello, everyone. This is question 24 of 100 clinically oriented anatomy questions. Let's get straight into it. It says a 58-year-old male farmer was accidentally struck with a scythe, a long curved cutting blade, by another worker while they were cutting wheat. Was admitted to the county hospital with severe bleeding. During physical examination, the doctor noted that the patient has foot drop. Although sensation was present over the dorsum of the foot and the skin of the posterior calf, which of the following nerves, which of the following nerve was injured? Option A, femoral nerve, sciatic nerve, superficial fibular nerve, deep fibular nerve, and the common fibular nerve. So here we have identified the important thing in this question that the patient has. It's foot drop. So foot drop is as a result of injury to the deep fibular nerve or the deep peroneal nerve, and that is option D. So here is our correct answer: the deep fibular or the deep peroneal nerve. That is the nerve injury that results into the foot drop. And foot drop results in a particular type of gait called the stepping gait. So whenever a patient has a stepping gait, it is safe to say that the patient has foot drop, which is an injury to the deep fibular nerve. So foot drop is the inability to dorsiflex and extend the toes as a result of paralysis of the anterior compartment muscles, that is anterior compartment of the leg. Paralysis of those muscles is what results into foot drop, and they are innervated by the deep fibular nerve. So that is the correct answer. Let's check through the other options. Option A is the femoral nerve. The femoral nerve innervates the anterior compartment of the thigh, and they are responsible for flexion of the hip and extensions of the toe. The sciatic nerve branches off into the tibia and the common peroneal nerve, and the tibia nerve innervates the hamstring muscles. The hamstring muscles innervate the the tibial nerve innervates the hamstring muscles, and the hamstring muscles are responsible for flexion of the knee and extension of the hip. While the common peroneal nerve is the one that bifurcates into the superficial fibular and the deep fibular nerve, so which makes option here automatically wrong also. The superficial fibular nerve gives cutaneous innervation to the dorsum of the foot. It also innervates the muscles of the lateral compartment of the leg, which are responsible for eversion of the foot. So the question mentioned that the sensation over the dorsum of the foot and the skin of the posterior calf was still present, which means that the superficial fibular nerve was not affected. All right, it means the superficial fibular nerve was not affected. So the correct answer here is option D, and the other options are wrong. And I believe you understand why they are wrong. And I'll see you in the next episode. Please make sure you like, make sure you subscribe, make sure you comment, and I'll see you in the next episode. Thank you.